Do you mind if I call you Mr. Partlow?
Yes.
So tell me what brings you in today.
Recently I've been having some abdominal pain.
Okay, so how are you feeling overall today?
Um, right now I feel good. It's just I have this little sharp pain in my stomach.
Okay, so does it make you feel nauseous or anything, or is it just that sharp pain?
Sometimes after I eat, I feel nauseous. But other most of the time I have a like a dull, sharp pain in my stomach.
So is it throughout the day or only after you eat that triggers it the most?
Normally it's throughout the day. Normally it's worse after I eat.
Okay, so on a scale of 1 to 10, how would you rate your pain overall?
On a scale 1 to 10, if 10 is the worst, then somewhere around a 4 or 5.
Okay, so do you do anything to help relieve some of that pain?
Sometimes I'll take a probiotic and a Tylenol.
Okay, so how do your body respond to that?
For the moment, I don't feel anything, but then once that wears off, then it's the same.
And you just kind of push through the pain?
For the most part.
And about how many times a week does this abdominal pain come on?
Every day.
Every day?
Mm-hmm.
Okay. And how long has this been going on for?
Um, for 3 months.
Okay. Um, so tell me, how are you feeling today overall?
Overall today, I feel fine. It's just I can feel this achy pain in my stomach.
Okay, so tell me a little bit about your past medical history.
Um, well, I was in a car or a motorcycle accident, and I broke my arm a few years back. I also had my gallbladder removed, and recently I was diagnosed with high cholesterol. So those are the big things.
Okay, are you on any current meds?
At the moment, I take a lot of vitamins, but I was just given a statin.
Okay, do you know how many milligrams you're taking of that?
I believe it's 20 milligrams.
Okay, and you said that you're also taking that Tylenol and probiotic to help your pain with your stomach?
Yes.
Okay, about how often do you think you're taking that?
A probiotic at least twice a week.
Okay. So, do you know if you have any allergies?
Um, I have an allergy, or I'm allergic to penicillin.
Okay, and how does your body respond to that?
So my body will break out into a rash, and then sometimes I get a fever.
You take anything for that?
Um, no, I just try to avoid it.
Okay, okay. Tell me a little bit about your family history.
Um, well, my father just got was diagnosed with diabetes, um, and high cholesterol. My grandmother on my father's side had passed away from pancreatic cancer. My grandfather on my father's side had died from a heart attack, but he also had high cholesterol. On my mother's side, my grandmother has she has many seizures, and she also has some heart issues, and then my grandfather on my mother's side has hypertension.
Seems like you have a pretty lengthy history there.
Yeah.
So tell me a little bit about yourself.
So I'm a personal trainer, and I typically like to work out 3 to 4 times a week. Uh, Most of the time, probably for 1 to 2 days, I'll do cardio, and the rest of the days I would just focus on like weightlifting.
Mm-hmm.
I'm a youth minister for my church. I have a wife and a daughter. Um, let's see what else. Um,
What do you like to do in your spare time?
I like to read. I like to go out to sporting events and hang out with family. And then on Sundays, me and my family we attend church.
Okay, what's your favorite team?
My favorite Football team, as far as colleges, LSU. My favorite professional team would be the. I'll go with the Cleveland Browns.
Okay. How would you describe your sexual life? You have one partner, multiple partners?
One partner.
Okay, that's just your wife, I'm guessing.
Yes.
Are you guys pretty intimate or?
Yeah.
Okay. Let me see. So now I'm gonna get into your body systems again. Do you have any headaches, dizziness, or fatigue, anything like that?
No headache, no dizziness, no fatigue.
Okay. What about any chest pain? You feeling short of breath when you're going up and down the stairs or when you're exercising, anything like that?
No chest pain. No shortness of breath. Um, no. The only time I feel anything in my chest is sometimes in my like my stomach pain. It kind of go.
Push up on it a little bit.
That's about it.
Any cough? Any history of asthma or bronchitis?
No.
Okay, so I know you say you came in for abdominal pain. Tell me a little bit about your bowel movement patterns and your appetite.
My appetite has not really changed. Um, I normally use the bathroom 1 to 2 times a day for a bowel movement. I drink plenty of water. I've changed some of my eating habits as far as eating more vegetables. As far as just eating a bunch of like protein. And I try to eat a lot of fiber, but for the most part, nothing has changed. It's pretty much a regular standard diet.
About how many times do you say you eat a day? Meals?
Depending on the day, most of the time I probably eat 3 to 4 times, 4 meals. The breakfast being probably the smallest one, and then eating a bigger lunch or dinner due to the fact that I normally work in the evening.
You drink a lot of carbonated drinks?
I do. As of recently, I do drink a lot of energy drinks.
What about caffeine?
Yeah, most of the energy drinks have up to like 200 milligrams of caffeine.
Okay. So tell me a little about your skin. Looks like you're pretty intact and clean and dry. Do you experience any bruising or bleeding to the skin?
Not that I'm aware of, no.
Okay. How is your urine, like the color? Do you have any urgencies or anything like that?
Well, my urine is normally clear. I try to discipline myself to drink a gallon of water every day. So most of the time I do use the bathroom frequently, due to the fact that I drink a lot of water.
Okay. Any history of UTIs or kidney disease?
No.
Okay. I know you said you had broke your arm back a while ago. Is that the only time that you had to use any mobile devices?
Yes.
Do you have any muscle weakness or muscle pain that you're experiencing?
No, I have not had any muscle pain. I have noticed that after taking these statin pills, that sometimes I have some soreness, but no pain.
Okay, so how would you describe your overall psych well-being?
I would say I'm pretty normal.
Are you on any antidepressant, anti-anxiety meds?
No.
Okay, have you had any trauma recently in your life or anything?
I have lost 2 close family members. In the last month or so.
So how are you coping with that?
Just keeping busy for the most part.
Okay, are you seeing anyone or reaching out for help?
At the moment, I'm not. But I am looking into finding some type of therapist or outlet that can help me process.
Okay, so how are you feeling overall currently about the death in your family?
How do I feel? I would say it's kind of hard to explain.
Okay, so hopefully you'll go ahead and get some counseling and get some help with that and get things on the road. Do you have any more questions or any concerns for me?
No. I guess my only question would be, what happens next as far as our process?
We'll probably get some tests ordered for you, and then have my nurse bring in some paperwork, and we'll kind of go from there.
Okay.
Okay, thank you. Have a nice day.
Thank you. You too.